Good afternoon, everyone, and welcome to our panel discussion on building healthier communities through prevention. Today, we come together to explore the critical roles that prevention plays in fostering community health. By focusing on prevention, we can reduce the burden of chronic diseases, lower healthcare costs, and enhance the overall quality of life for our community members. This discussion will highlight innovative programs, successful initiatives, and collaborative efforts that have made significant strides towards building healthier communities. Without further ado, let's dive into our discussion and explore how we can collectively champion the cause of prevention in our communities. First, I would like to start with Sheikha Dr. Noura. So, what are the strategies and initiatives that Emirates Medical Association is implementing to ensure that prevention is at the top of the healthcare agenda? Please.
Thank you for the question. Emirates Medical Association has a major goal and vision is to involve all the health disease to detect it and to tackle what are the challenges in order to contain it. So there are certain strategies and criteria identifying the diseases, collaborating with the health regulatory bodies by all means of having upgrading and upscaling the protocols, guidelines in prevention, and also working parallel with the hospitals in collaboration with the societies that in need for a certain disease. For instance, like diabetic retinopathy, Emirates Medical Society of Ophthalmology is working so hard in order to conquer the diabetic retinopathy and to have the, by all means, the parameters of preventing it by screening. Working together in parallel even with the endocrinologist, and this is what we had also as an initiative, as a national program to eradicate the diabetic retinopathy challenges for our patients in the next 5 years. Another great example, breast cancer awareness. This is also a way of preventing the cancer. So the Oncology Society is working so hard in preventing those type of cancer, which is really common. Implementing and following the international guidelines in preventing measurements and parameters coinciding with the updated way of practice. There are a lot of conferences, workshops, even spreading outreach programs, campaigns, and even conducting events in malls or schools to, let's say, as an ophthalmologist, to eradicate the vision, the poor vision, which is called amblyopia. So school screening is really important, not only for vision, also for the dentistry. By all means, all the society is working hard, tackling the diseases, and then putting the strategy how to prevent it. Yeah.
Thank you very much, Sheikha Dr. Noura. So it is very interesting to see how you cover, it's not just for the high-risk people or to the adults, but, starting from the children, that's the most important step that you have taken. And it's a great vision, actually. And it also aligns with the UAE vision on how we can improve the community health. And it is very important that children should be, healthy. And introducing these new lifestyle changes and implementing all these interesting and great initiatives that will change their mindset as well. So it's so interesting, and thank you so much.
Thank you. Thank you. Actually, the stepstone of any human being is since childbirth. So when we eradicate or focus on what are the diseases or the signs and symptoms of preventing those diseases to develop, this is the first key of achievement.
Thank you so much. Thank you so much. So since we are talking about this healthy lifestyle and longevity, so my next question is Dr. Fawad. So Cleveland Clinic Abu Dhabi launched recently its longevity program. Can you please tell us more about it and how it aligns with the national vision?
Thank you so much for the opportunity. The Department of Health and the leadership in the country have identified cancer prevention as one of the key priorities, and that Cleveland Clinic Abu Dhabi has embraced and reflects in the longevity medicine section in the Cancer Center. The longevity medicine section focuses on population who are at increased risk of developing cancers and population who have already had cancer, so cancer survivors. And this set of population are managed in the longevity medicine section under multiple specialty clinics. So this program is very, very unique to the country, probably to the region as well. And the multiple specialty clinics include Hereditary High Risk Clinic. This clinic focuses on population at increased risk of developing cancers. And typically it's families who have either cancer gene mutations or strong family history of cancers. They undergo risk stratification using the family history, the personal history, the genomic information, and if found to be at increased risk, they're placed on personalized precision prevention programs. And to date, we have over 800 high-risk patients. And we were also working very closely with our partners at M42 and Department of Health on the Emirati Genome Program. The second specialty clinic is the Cancer Survivorship Clinic, which focuses on patients who have had cancer. Typically, the patients would be introduced to this program right after diagnosis, but they join the program usually about 6 to 12 months later after they've had their active cancer treatment, chemo, radio, surgery. And the program focuses on managing the adverse effects of cancer treatment, managing surveillance, doing a personalized risk assessment to see if there's any hereditary underlying cause for the patient and their families, and promoting healthy longevity. So in the Hereditary High Risk Clinic, when we offer prevention programs, the four key pillars of prevention are enhanced screening, lifestyle modifications, preventive medication, and preventive surgery. So these are kind of the two frontline clinics, and they're supported by multiple other specialty clinics, starting from the lifestyle clinic, where we have 3 lifestyle physicians working on promoting healthy lifestyles. We've got oncology nutritionists, 2 nutritionists who work on the healthy diet for these patients, both high risk as well as cancer survivors. We've got oncology psychologists. We know both cancer as well as high risk patients, there's a significant mental health impact. We've got our physical therapists, so 2 oncology physical therapists working both on promoting regular exercise and also managing any physical disability from the cancer treatment. We also have a genetic counselor, American trained, certified, doing a very important role with pre and post-test counseling. And then finally, we have some complementary therapies such as Reiki therapy, and this is a program that is growing. All the entire ecosystem working together to focus on at-risk patients and cancer survivors to promote healthy longevity. And so we're very proud to present this program, and it's continuing to grow.
Thank you so much, Dr. Fawad. So it's great to know that you have a comprehensive center to take care of each and everything. Like you have genetic counselors and oncologists and everybody to make sure that to increase the life expectancy of these patients. So that's very nice to know. And thank you so much for leading this initiative at Cleveland Clinic Abu Dhabi. So since we are talking about the prevention, as we all say, prevention is always better than cure. So let's move on to Mrs. Maryam. So Maryam, I would like to ask you, what strategies and approaches can healthcare providers implement to foster healthier communities through preventive measures?
Thank you, Dr. Vidya. Actually, prevention, it's a very hot topic today. All of us, we talk about prevention. Nevertheless, obesity is increasing. We have lots of diabetic patients and other chronic diseases as well. As M42, we believe that we want to lead the prevention within healthcare. We're building a very holistic strategies. We want to understand what is our community need. We live in a community that is very diverse. We have Emiratis, Arabs, Asians, African, European. Each population, each group is unique. As a healthcare provider, we believe that we need to understand what the needs. We need to do our assessment of their healthcare needs as well. In addition to that, what we are doing in terms of screening, we need to catch up those populations as early as possible. Newborn screening, school screenings, periodic screenings. When was your last time you visited a doctor for screening? When was your last time that you did certain checkup? We are all busy. So that's our role as a healthcare provider. We need to step in. We need to reach you as a community. We need to start knocking your doors within your homes, your workplaces. You will see us all over the communities, within the play areas and other malls, shopping malls. This is the new era now. Not only this, telemedicine is there. We are upskilling our telehealth. We will reach you with our physicians, with our healthcare professionals. We will talk your language rather than certain jargons that you cannot understand coming from a healthcare provider. In addition to that, shall we add behavioral therapy, behavioral science with our hospitals, clinics? For sure. I think the role is very comprehensive. We need physicians, nurses, dietitians, mental health, but as well, we need to add behavioral science. It's not about you should not eat this, you should exercise. It's about how. Most of the patients will sit there seeing the physician. It's like, okay, how? Show me, tell me how. So this is the new approach that we're looking for at M42, and this is how we can drive a change within healthcare. It's about upskilling, education, promoting, and reaching and understanding our communities.
Thank you so much, Maryam. I really love the idea of how proactive the healthcare professionals should be to reach out to the general public to make sure that we prevent before it happens. That's the whole idea of preventive medicine, and also how you would be using the telemedicine and talking in their language, right? So that people are not scared of all these things, so they should understand. Basically, you are educating the general population to understand what is the importance of doing this, annual checkups or screening tests. So that's wonderful. Thank you so much for sharing your thoughts with us. And these days we are hearing a lot about artificial intelligence, right? So everywhere it is, everybody is using it. So now we would like to learn from Dr. Fawad, like what role is artificial intelligence is playing in prevention space, please.
So Cleveland Clinic Abu Dhabi was the smartest hospital in Middle East in the region last year. And we were one of the first ones to embrace innovation, artificial intelligence. In the cancer space, and especially cancer prevention space, we have from diagnostics to therapeutics, we are using artificial intelligence. So the patients who are identified at being high risk, they're placed on enhanced screening programs. From imaging, where we are training AI models from our radiologists, to patients who need any pathology from the abnormal samples, whether it's from imaging or colonoscopies. Our pathologists are training AI models in that area. Patients who need germline genetic testing to identify whether they are at increased risk, in addition to the personal and family history. Our partners at M42 are using AI embedded algorithms right from A to Z throughout germline genetic testing as well as somatic tumor testing. And then on the therapeutic side, we are also using AI in the pharmacogenomics space. So patients who need preventive medication, which is one of the key pillars we have, hugely used in patients who are at increased risk of breast and colon cancers. We use preventive medication, and we usually would have a pharmacogenomics report to understand if they will be suitable for a specific medicine, whether it is the right drug or whether we need to alter the dosage of the drug based on the pharmacogenomics. So, through the spectrum, AI is being used, and we are continuing. This is just the beginning. So we are continuing to use more and more AI where we feel it will add value to the clinical outcomes and bring efficiency to our systems.
Thank you so much. Like how we are utilizing the genomics information. As you all know, the UAE, we have this wonderful Emirati genome project where we already sequenced 800,000 Emirati people, and then using the pharmacogenomics information to actually find out who would respond better for certain drugs and who wouldn't, and then checking the drug and the gene interactions and utilizing this AI to actually predict this effectiveness of the drug treatment is really wonderful. Thank you so much for sharing this. And when we talk about community health, the most important aspect is also about chronic disease management. So I would like to ask Mrs. Maryam, as a healthcare provider, how do you approach the management of chronic diseases within the community to ensure long-term patient compliance and improved health outcomes? Please.
Thank you, Dr. Avidia. Actually, we need to reach our patients with the precision medicine. This is your field, definitely, but to have a very detailed, personalized care plan. What fits Dr. Avidia will not fit Maryam, definitely. So we're always talking about let's have a personalized patient care plan, but this is not yet happening. So definitely this is our priority to look in a very personalized care plan. In addition to that, to do upskilling for our healthcare professionals and how to catch up those patients as early as possible. This is the whole point of prevention and chronic disease management as well. Are we doing follow-up with those patients where they are? Is there a follow-up system? Is there a tracking system that we can alert them if they are late within their medications, appointment, or that we need to act? Are we having a very good service for patient remotely who's living in a very far area to catch them and to do a proper disease management for those kind of diseases? So as you can see, it's a more of a holistic approach of how we can have those kind of rapport and the relationship between us and the patient.
Thank you so much. I really love the idea of this remote patient monitoring, also utilizing artificial intelligence and all the digitalization aspects. Thank you so much. We have some time for questions from audience, and if you have any burning questions, please raise your hand. Yeah, please.
Well, thank you so much for the very nice talk. I have a question. So talking about personalized care for patients, which is, I believe, is the way to go for the future, would you be willing to uptake new technologies when a personalized care is provided?
You all can take it. We would love to hear, please.
Definitely. Actually, our strategy is digitalization. This is what we were mentioning and we talk about. Definitely, technology. I think everyone now using smartphones. We cannot live without it. Our aim is if I can monitor my health with certain application with smartphone, this will be perfect. Thank you.
In the cancer space at Cleveland Clinic Abu Dhabi, we are hugely invested in innovation, in AI, in technology. So we've already discussed how AI is being used in diagnostics and therapeutics, but we are also looking at biomarkers. So I think this is the hot area where we've already, for colon cancer screening, we are offering the biomarker. We are also looking at liquid biopsies for pancreas cancer screening, and we have an ongoing study going on at the moment. So we're keeping a very close eye on that space as well. We're also looking at, in addition to DNA testing, what else can we do to have more personalized risk assessment for our patients. So we know that with more and more genetic testing, DNA analysis, we are getting up to 25% of VUSs, so variants of unknown significance. So is there a way to reclassify those? And we're looking at RNA testing at the moment. We're closely working with our experts at M42 to look at some studies. And so hopefully there's a lot more coming our way in terms of metabolomics, epigenetics. So we as this becomes more validated, we'll be glad to pass it on to our patients. Thanks.
Sheikha Dr. Noura, if you want to comment, please.
Well, actually, the prevention is a very important key, and giving the preference for community, it's very important. So the most important in order to tackle or identify the disease itself, we need to know the prevalence of the patient, because patient from other patient differs. So it will be like a custom-made way of treatment and holistic approach, given the fact that there are a lot of risk factors also that will add to the management. This is really important to have a custom-made, tailored management in the future, inshallah, based on the input or the data of the patient itself. Thank you.
Thank you so much. Any other questions from audience? Yeah, please. Somebody can please pass the mic here. Here.
Thank you. In regards to prevention, one topic been coming up a lot is the idea of longevity, but also health span. And how do you improve health span, identify your biological age earlier or later through biomarkers or through others? So how do you see that playing a role, as well as how do we incentivize people to actually be more engaged in that kind of platform?
Great question. Thank you. So we, in our longevity medicine section, have not only the hereditary high risk and the cancer survivorship clinic, but we have the entire ecosystem of lifestyle physicians, nutritionists, exercise coach, psychologists, because we understand from studies that if cancer is prevented in a population, it really increases the lifespan by 3 to 4 years. So there's a lot more than just preventing cancer. And therefore, we understand that there is a huge focus in our program on managing the cardiovascular disease, the metabolic disease, obesity, and a number of other concerns in our community and diseases have to be managed simultaneously. And therefore, this entire program is very unique. And we have a dedicated team to work on all these simultaneously. And therefore, hopefully this will help us having a healthy lifespan going forward. And a number of research projects are also being undertaken in this area, so we can continue to innovate and see what else we can do for our high risk and cancer survivors. Thanks.
Thank you.
Anybody would like to comment? Dr. Sheikha, Dr.
Can I switch the gears to ophthalmology, talking about biomarkers? On our daily practice, like a retina consultant, we do depend on biomarkers in retinal diseases. So this will give us predictive or a prediction if the management itself or the injection into the eye is going to work or not. And it's not only based on the biomarkers, it's a holistic approach. As Dr. Fawad said, that it's a multidisciplinary program. So I don't work alone, solo. I have to involve the endocrinologist. If the patient has a comorbidity or he is he has end-stage renal disease on dialysis, so I have a predictive, or I can assume that how much my management will be effective. I won't inject a patient in order with a high HbA1c, which shoots more than 13. So there are biomarkers that will give me an estimation of how my management will work on this patient. And definitely, as I mentioned previously, that it differs from patient to patient. Yeah. Thank you.
Thank you so much. So if there are no other questions from the audience, so I would like to thank all our wonderful speakers and to walk us through what kind of strategies and vision we should have to build healthier communities through prevention. So I hope you can take this message home and then spread the word. Thank you so much for your attention. Thank you all.